Welcome to the video presentation Community and Public Health in Victoria, Australia, a nutrition focus. Today you'll learn about some of the differences between community and public health organisations, as well as the components of a successful community health service. Part 1 looks at the role of these organisations in providing healthcare and promoting healthy eating habits, as well as features and components of community and public health organisations. Inner South Community Health Service, which services the inner southern region of Melbourne, will be used throughout this video as the example of a community health service. The National Health and Medical Research Council, the Public Health Association of Australia, and the National Heart Foundation will be used as the examples of public health. Community health services are a major component of primary health care in the state and receive funding from the Department of Health to provide a range of healthcare and community services to specific geographical areas within the state. Services offered depend on the specific need of the local community, but aim to address all of the determinants of health, build capacity, and have a particular focus on lower socioeconomic groups and those with traditionally limited access to healthcare. Public health organisations are concerned with population health, with a focus on the determinants of health and causes of ill health. Community health services promote healthy eating habits in a number of ways, including use of dietitians for individual dietary counselling, education and capacity building programs, public health campaigns, and by utilising partnerships. Public health organisations use research, policy, advocacy, public health campaigns, and the development of guidelines to promote healthy eating habits. This is an example of the organisational structure of a community health service and a public health organisation. Community health centres must be accessible to all members of the community, particularly groups who traditionally have difficulties accessing the healthcare system, such as lower socioeconomic groups and the Indigenous population. Public health services use a number of mediums to reach their audiences and provide access. Both community and public health services must regularly evaluate services and programs and seek consumer feedback to ensure they are effective. Both community and public health organisations are accountable to their consumers, who expect accurate, up-to-date, equitable and quality and evidence-based practice. These are the rights of the Inner South Community Health Service clients. Strategic partnerships with health and other related services allow community health organisations to extend their available services to offer a continuum of care for clients. Community health services are members of primary care partnerships with other health and welfare services and organisations. Partnerships are also important in public health to extend the knowledge base, influence policy and practice change, and have a broader reach. Community health centres aim to meet the healthcare needs of their catchment area, and so community involvement is vital in understanding community needs. Public health services generally encourage public input and involvement to ensure practice is relevant. The second part of this video will use Inner South Community Health Service as an example to demonstrate the essential components of a successful community health service in action. A number of components are required for a successful community health service. They must be accessible to all members of the community, strive for quality, provide equitable and targeted services to reach those with the greatest need, and always promote health and well-being. Services should be coordinated with a multidisciplinary approach and should be responsive to the needs of the local community. Community input and feedback should be encouraged and fed back into planning and strategies. The development of strategic partnerships allows a broader service offering. Services should focus on building capacity and self-management, and there should be continuity of services. And services should always be population-based. Community health services aim to identify and minimise the barriers to healthy eating for their community. Motivation, knowledge, and capacity deficits are addressed through individual dietary counselling, group-based learning programs, and public health campaigns. Financial and physical access barriers are addressed through related services and programs, such as the provision of transport, financial planning, and budgeting assistance. Cultural competence is an essential attribute of community health services and practitioners to cater for culturally diverse communities. Practitioners and services must understand the unique needs of CALD communities, use interpreters when appropriate, and ensure all educational and promotional material is available in appropriate languages. All staff should complete cultural awareness training. For more information on the healthcare system in Australia, see Australia's Health 2014. Thank you for watching.